Good evening. I am Dr. Sridhar Kalyanasundaram, consultant neonatologist and pediatrician. I have made a number of videos on medical topics, both for parents and for the parents as well as the medical professionals. In this video, I am going slightly off topic. The reason is that my daughter has been selected to join medicine in Oxford, and she is currently in UK waiting to join the university. So first of all, I would like to congratulate her and thank you all for your best wishes as well. And as a proud father, I do look forward that she has a successful career. Having spent 30 years in the medical field, I joined medicine in Stanley Medical College in Chennai in 1989, and I was 17 years old at that time. So having spent 30 years in medicine, 31 years now, you can say you start the medical career right from the time you enter the medical college, and if you start from the time you finish medicine, it's 26 years now. Of course, you learn all along the way. You have a lot of struggles, you have a lot of hard work, you keep studying all along. So just to summarize my career, it's basically medicine till 1995, including 1 year of house surgency when we are actually doing doctor stuff. And 1995, I wrote the PG entrance exam. We had the All India entrance exam, and I was lucky to have a good rank in that, and I managed to enter JIPMER Pondicherry, which is a central institute, to do pediatrics. So when we finish your medical career course, we look to join post-graduation, and you choose your post-graduation depending on what you feel suits you best during your medical training, and also based on your seniors advising you, your family advising you, if you're lucky to have doctors. My sister is a doctor as well, and she had chosen pediatrics as a career, so that motivated me to take pediatrics as well. 3 years course in pediatrics, that is the MD pediatrics degree. Soon after that, I joined for my DM in neonatology, which is a sub-specialization or super specialization, as you may call it. So this is into newborn training, care of the newborn babies, especially the premature ones or the sick babies. So this course is again for 3 years. Both the MD and the DM have a thesis or a dissertation as part of it, and you do exams at the end of it, including a clinical exam. You have a rigorous training, and I was lucky to train in Postgraduate Institute of Medical Education in Chandigarh, so PGIMER it's called. It was an excellent tertiary institute. I'm very thankful to my teachers, both during medical college, post-graduation, MD pediatrics in JIPMER, and DM neonatology in PGI. So that's 5.5 years in medicine, plus 3 and 3, 6 years. Subsequent to that, I had a short stint in Coimbatore for a year in a private hospital. That was a good learning experience because I actually set up the neonatal unit with my colleagues there, trained the nurses a lot. So it started my interest in teaching the nursing staff, spreading knowledge, and so on. We did a good job setting up the unit. Our ventilated baby survival rate was very good. Subsequent to that, I went to Abu Dhabi for 2 years. I worked in a private hospital called Ahalya Hospital. And that was a great experience because that was the first neonatal unit in that hospital. Again, I had the role of setting it up, and I enjoyed it. Of course, I was doing general pediatric practice to some extent, as well as neonatology wasn't too busy at that time. I did my MRCPCH exam, so during the course of that work, we can study and we can take these exams online. We do have the clinical part for which you need to travel. I was lucky to travel to UK for the first time in 2003 when I did the MRCPCH exam, and I was again lucky to clear it at first attempt. One of the regulations at that time to go to UK was that if you clear the MRCPCH exam, you don't need the PLAB or the Professional Linguistic Board exam, and this was an advantage. So I could take a telephone interview from Cambridge, and I got a job as a fellow in neonatal transport in Cambridge. We had the transport team there called the Acute Neonatal Transport Service, and I was very lucky to work in a tertiary center in Addenbrooke's in Cambridge. And during that period, I was recognized by the General Medical Council to work as a consultant in UK, and I became a consultant in Scotland. I worked there for 7 years. During that period, I got my fellowship into the Royal College. I became an examiner for the MRCPCH exam. I also became a trainer for the resuscitation courses. I then decided to move to Dubai, where I worked for 5 years in American Hospital, which is a prestigious center here, and moved on to Zuleika Hospital for the past 2.5 years or so. I've had a very fruitful career so far. I've been very fortunate to work with excellent team members all through. So having been through such a long course, of course, even now we don't relax. We have to keep studying. Medicine is now evidence-based. Parents are having all the information at their fingertips, so to speak, so they can Google it up. Of course, you should be clear about what information you're looking at. You shouldn't read unnecessary stuff. You shouldn't be worried unnecessarily about the condition. You should follow what your physician advises you. But at the same time, you do have all the knowledge available to you. So it's very important that we take care to update ourselves as we go. I do feel proud that I have been involved in many conferences, both as an organizer, as a chairperson, as a president of a conference, and so on. And I have spoken in many meetings here. Some of the recordings are available in the channel as well. So preparation, so your time is not limited to what you work as well. We have a 48-hour working week, including some weekends. We are on call during the night, and subsequent to that we have to keep up to date. You have to pick the cases which you want to read about, where you have a doubt, and you may have to tell the parent that actually I'm not totally sure about what's happening. I'll have to refer to a colleague, or I'll discuss with them and read more about it and get back to you. So there is no pride when it comes to medicine, because there are always the difficult cases which you may not have encountered before. Even if you read about it in some stage, you're not likely to remember it all the time. So this is what we have to think about when we think of medicine as a career. Is it a suitable option? You have to study a lot. You have to keep studying. Your workload is not confined to your working hours. But having said that, I have had the past few weeks where I have been discussing it with my son, who is now 15, and he is at a stage of his career where he has to make up his mind. And actually, I'm not discouraging him joining medicine. My daughter has already decided to start medicine. I told you my sister is a pediatrician, and her daughter has actually joined medicine. She's about to enter the final year, or she's probably in the final year already. My wife is also a pediatric endocrinologist, and so we have a career, we have faced many doctors. So what has happened is we have become quite narrow viewed. In that sense, we don't have much experience with any of the other fields. So my father used to work in a bank, but things are very different now in terms of banking. The finance industry is not as secure if you are in the lower rungs. Of course, once you go high, you can crack it in any field. So even in IT, for example, those who do well, those who are innovative, they definitely do much better. But those who are in the lower ranks, they do have job insecurity, especially in the recession in 2008 and in the current recession as well, COVID-related conditions. So medicine is a relatively recession-proof career. So I told you that I was advising my son. I also took him for a period of observership, and I would like to thank the management at my hospital for permitting that. He enjoyed it, and at the same time, whenever we encountered, some of you might have come across as well, that I was asking the parents as to what their career was, what they felt about the career choice, and how they would advise. Everyone has a slight insecurity given that we have the current crisis. Of course, if you crack it big in any field, you do well. And if you are in the IT sector, for example, if you have a key for innovation, you would definitely do well. So my take on medicine as a career, of course, it's hard work, but it's very satisfying. So we feel proud that we are able to save patients. We feel happy when we see the smiling faces of the parents. We feel very happy that we're able to help others solve their problems, reduce their tensions. We also act as counselors for them in some situations, and you do start approaching problems in a more sensible way, even in your own personal life. The negative, of course, is that you kind of become numbed in emotion, so you don't react as much to situations as others would do. And even in case of death, for example, you are reasonably taught, or you develop a psychological shield where you start thinking rationally about anything, illness, death, and so on. So if someone is ill in your family, you may not be as caring or doting as they may expect. So you start looking at what next, rather than what we should do to support them at this stage. So is it really life-threatening? Do we need to do anything as a next step, and so on? You do feel anxious, but it's not going to be as expressive, so to speak. So that's one negative. And how you show your emotions varies from person to person, but in general terms, medical people generally have muted emotions to some extent, as far as I have seen. Maybe I'm wrong. The hard work that I mentioned, of course, goes with the profession. You do get your rewards. So money in medicine is not huge as it would come in with this business or someone who has made an app, for example, like Zuckerberg. But it's reasonable. I mean, you are on the top rung of the career in earnings in terms of any community. You are in the top 5 to 10%. And as you become more experienced, you're probably in the top 3 to 4% of the community earnings if you put them in order. So you are going to be in the top 5 to 10% most of your career once you start medicine as a career. So you're reasonably well to do. So you don't need to worry about money during your career course. Hard work and learning, I mean, you start getting used to learning as part of your life, so you're not really too worried about learning. It becomes your routine. Of course, you dedicate time to that. Your time for relaxation may be less, but again, it's a work-life balance depending on the type of job you get. Sometimes if you have a quiet clinic, you catch up on an article while you're at work, and some of us listen to online webinars. It's become more now, and you can easily access information by messaging a colleague and getting exactly what you need if you don't have time to read the full chapter, for example. So you do get used to the learning part as well. And how much of a work-life balance you create depends on the type of practice you have. For example, if you're practicing in UK, you have the National Health Service. Most of the time you have the option to have private practice, but it's your choice, and not every field can do private practice. And if you are in India, for example, people are working majority of the time in both government setups or in hospitals during the daytime, and then they have their own private practice. They're also available for attending, for example, in neonatology or obstetrics, they attend deliveries. The anesthetists go wherever the surgeons are needing help, and so on. So they freelance as well. So it becomes a very hectic schedule. Your phone keeps ringing all the time, and in my case, for example, I don't share my mobile number with the patients. I do share the email, and I'm accessible on email. Majority of the time I reply within the same day. So parents do feel some support from that. But of course, the doctors who share their mobile number or WhatsApp number are helping a little more than what we are by giving just the email, because they are accessible more. But it comes at the cost of your time, your sacrifice. You have to decide which field of medicine might interest you, and regarding choices, even if you have if you have an interest in management, for example, you can do medicine and then do management in medicine. If you have interest in IT, you can do medicine and you can branch out into, say, artificial intelligence in medicine, or application of into ICT knowledge in designing software. So you could do software suitable for medicine. You could do documentation software as well, which is quite important these days, which is a big revenue generating business as well. You could bring quality improvement tools for medicine. So doing medicine gives you the insight into how to do further, and you could do additional courses in IT and combine both as well. So these are options. So finally, summarizing what I've said, I do feel after 30 years in the medical field that medicine is a good career if you have the stomach for a lot of hard work, lot of commitment. It's a dedicated field, so obviously you have to be fully committed and dedicated all the time. There is no shortcuts. You're dealing with life, so you cannot shy away from learning and updating yourself. And of course, it's a field where a lot of communication and interaction is there, so you should be ready for that as well. So lifelong commitment to learning, lifelong commitment to dedicated and hard work, and sincere approach is very important. So if you do choose medicine as a career, for anyone in your family, I would like to wish them all the best. And thank you for watching this. Do share with anyone you feel this might help. Thank you.